Hello friends, I hope everyone is fine. In this video we'll talk about differences and the similarities between the SARS-CoV-2 and SARS-CoV-1 because so many scientists and doctors in the medical community, they are talking about that the end of the SARS-CoV-2 will be like the end of the SARS-CoV-1 ultimately because there are so many similarities between the two. Except the transmissibility because SARS-CoV-2 is very much transmissible as compared to the SARS-CoV-1, and that is basically because of the genetic change which happened and became the reason that human contracted this virus. So other than that, these two viruses are very much similar, and as per the existing knowledge about the SARS-CoV-1, we know that even after 17 years, now those people who have got this infection and they ultimately recovered, they still hold the antibodies against the SARS-CoV-1. So it will be fun to know what was the SARS-CoV-1 and what is the SARS-CoV-2, what are the coronaviruses and how many coronaviruses up till today the humans have come across. So let's start the video. The first logical question which arises in our brains is why we call the coronavirus. Coronavirus is a combination of the two words. One is the corona. It's like a crown. If you look at the anatomical structure of the coronavirus SARS-CoV-2 itself, it has got certain spikes on the surface of it. These spikes, they give this virus appearance of a crown of a king. So that is why we call it corona, like a crown. Then comes the word virus. A virus is a submicroscopic infectious agent that replicates only inside the living cells of an organism. So this is the definition of the virus. So the literal meaning of the coronavirus is the one which I just described. Let's look at how many viruses we have come across up till now in the human history. There are 7 known coronaviruses to have had infected the human beings till today. One is the human coronavirus 229E, another is the human coronavirus NL63, one is human coronavirus OC43, another one comes the human coronavirus HKU1, and there was a very famous coronavirus which caused the infection in the majority of the Middle Eastern countries, and its name is Middle East Respiratory Syndrome, very famously known as the MERS-CoV. It started from the bats from the China and somehow got its entry into the camels, and from the camels human got it. So MERS, it caused so many infection and the mortality rate was 35%, and it caused the infection during 2012 and 13 time. Then we come to the SARS-CoV-1. SARS-CoV-1 or the severe acute respiratory syndrome COVID-1. It happened during the 2002 and 2003 time. In the old days we used to call it SARS, but after we started having SARS-CoV-2, then it got its full name SARS-CoV-1 with respect to the SARS-CoV-2. So it has caused some damage to the humanity as well, which we are going to see shortly. Then came this pandemic of the SARS-CoV-2, which has literally devastated the planet Earth, and this is what it's doing right now. The question arises why we call it SARS-CoV-1 or 2. I already mentioned what are the coronaviruses, but what it stands for and what it literally means, SARS. Severe acute respiratory syndrome. SARS stand for severe acute respiratory syndrome. Why we call it severe? Because of its intensity. Why we call it acute? Because this is not chronic, it happens. Patient did not have it a long time ago. So it happened just a short while ago. Why we call it respiratory? Because mainly it affects lungs and the respiratory tract of the body. Why we call it syndrome? A syndrome is any condition which not only affects one organ but also affects other organ or other parts of the body. So the medical definition of the severe acute respiratory syndrome is when you need to give a lot of oxygen, but a very few oxygen is able to reach to the body, and that gives us a PaO2 divided by FiO2 ratio of less than 200. What is PaO2? This is the partial arterial oxygen concentration. And what is FiO2? FiO2 is fraction of the inspired oxygen. So if we are to give a larger amount of the FiO2, but it ends up in a very few percentage of the partial arterial oxygen, then this is what we call a reduced PaO2 or FiO2 ratio. The other entity which is must for the definition of the SARS is the bilateral lung infiltrate. When you get the X-ray or the CAT scan or CT scan of the patient, then you will see bilateral lung consolidation or whitening of the lungs, and combined with this ratio which is less than 200, this is what you call the acute respiratory syndrome. So or ARDS, also known as acute respiratory distress syndrome. So this is famously known as ARDS, acute respiratory distress syndrome, because this is the definition of ARDS which we see so oftenly in patients who are suffering from severe acute respiratory syndrome. When they are immunocompromised, they have got chronic medical condition like diabetes mellitus, hypertension, chronic obstructive pulmonary disease, they are asthmatic, they have got any cancerous condition in which they are given certain chemotherapeutic agent which makes them immunocompromised, and so many other conditions. They ultimately end up in the ARDS, acute respiratory distress syndrome, where we see a PaO2 or FiO2 ratio less than 200 and bilateral lung infiltrate. Now if we look at the SARS-CoV1, which is the severe acute respiratory syndrome coronavirus 1, its source was the bat. These are known as the horseshoe bats, and these were located in the south of the China, and the intermediary animal was found to be civets. It all started in the middle of the November 2002, and the patients used to give the symptoms of the fever, cough, especially dry cough in the beginning, and they used to have fatigue and body aches. The condition of the SARS-CoV1 was diagnosed with the help of the reverse transcriptase polymerase chain reaction, PCR, which was conducted on the nasal secretions, especially from the nasopharynx or back of the nose and the throat. There wasn't any supportive treatment, there wasn't any specific treatment, only supportive treatment was available. Patient used to be given the symptomatic management, and if they were dropping their SATs and they were moving towards the ARDS as I just mentioned, then they used to be hospitalized for oxygenation and rest of the supportive management. There were almost there were like more than 8,000 infections, and 774 people died of it. Almost 33 countries they got affected, and human to human transmission was confirmed because it came from the bats through the civets, and ultimately humans started to transmit the infection from one person to the other. Now let's look at the SARS-CoV-2. But before going to the SARS-CoV-2, the question arises when and how the SARS-CoV-1 ended. This SARS-CoV-1, it started around like 16 November 2002. It was the start of the winter, but it almost ended in the June next year, June 2003. So let's see what are the similarities between the SARS-CoV-2 and 1. The source is the same as the source was from the SARS-CoV-1. These are the bats. Location in the center of the China, in the Hubei province. Up till now, we don't know what is the intermediate host. It all started, or it was reported to the World Health Organization on 31st December 2019. But scientists think that China started having these cases towards the end of the November, and in the December they had almost 40 to 50 cases. Symptoms were fever, cough, body aches, loss of sense of smell and taste, and some people also develop abdominal pain and diarrhea. The diagnosis is the same. The scientists used the polymerase chain reaction done on the nasopharyngeal secretions to diagnose the SARS-CoV-2. And it was in the beginning of the January, China shared the genomic sequence of the virus with the rest of the world through online medias. Treatment is only supportive. Like SARS-CoV-2, we haven't got any specific treatment up till so far. And up till now, there are 76 million people infected across the globe. And there are 1.6 million deaths. So there is a huge difference between the SARS-CoV-2 and SARS-CoV-1. And this difference is because of the transmissibility of the virus. The genomic change which happened in the part of the RNA, because coronaviruses are the RNA viruses, single-stranded RNA viruses. That change actually caused a change in the spike protein in a way that SARS-CoV-2 became much transmissible as compared to the SARS-CoV-1. That is why it spread across the globe, had already infected 76 million people and cost lives of 1.6 million people, which is a huge cost. So the question arises, what can be the end of the SARS-CoV-2 if we are sort of comparing it with the SARS-CoV-1? Mukhtalif scientists think that we need to have antibodies against the SARS-CoV-2, like even after 17 years of the SARS-CoV-1, those who got infected, they still have the antibodies against the SARS-CoV-1, which became a reason of the end of the SARS-CoV-2. In order to have those antibodies, we have got two options. One is the natural infection and one is the vaccinations, because they will then result in the presence of the antibodies or immune system priming in a way that when 60 to 70% will have those immune system primed or they will have the antibodies against the SARS-CoV-2, then we will label it as having achieved the herd immunity. Now, if we try to follow the natural path, then it will cause us a lot of deaths. It will cost us so many precious lives. So this seems a very difficult path. We have got one example of the Sweden, which tried to achieve herd immunity through the natural path, but they couldn't get it. So the second option is to follow the vaccinations protocol, because that is the way forward. That will help us have antibodies and priming of the immune system, because immune system have got antibodies, they have got B cell and the memory cells, and they also have got the cytotoxic or T cells or the CD8 positive T cells, along with the CD4 positive helper T cells. So that is the combinations of the immune system of the body, which we will have hopefully after we get vaccinated with the vaccines which have been developed and are being used against the SARS-CoV-2. So that is the end which we are just looking at. So if we don't have side effects against these vaccines, then we hope to achieve that goal. Now there is a question what options we have got in Pakistan. If someone is infected, he or she has got only the supportive treatment. Someone who got infected need to isolate for 2 weeks. So in order to prevent the transmission of the virus towards the family members and the friends and the rest of the community. So that is why we ask the people who have become infected, they need to isolate for 2 weeks, because after 2 weeks, this virus hopefully is not infectious or is not going towards anyone else. But they also need to talk to their doctor, because they don't need any home remedies or the herbal medications or things like that, because this viral infection only needs a supportive management. Hospitalization is required when if you check your pulse oximetry, or you do pulse oximetry and you check your saturation or oxygen concentration in your blood, and this is going below 92% and you have got the infection, then you need to talk to your doctor and hospital for getting admission to the hospital. In Pakistan, we are still awaiting the vaccine. A Chinese vaccine made by the CanSino company. The name of the vaccine is Ad5nCoV19. Its phase 3 trial are going on in Pakistan, and hopefully soon we will get the result. And because this is the first time Pakistan has ever conducted a phase 3 clinical trial of any vaccine, so it's a very exciting time for us in Pakistan. But as long as we don't get the vaccine, we need to maintain a physical distance of 2 meters or 6 feet from each other. We need to avoid going to the crowded places, and if we happen to be at a place where there are people around us and it's very difficult to maintain the distance, then we need to wear a 3-layered mask. The inside layer will hold your secretion and it won't let it go outside. The outer layer will help you protect yourself from the secretions of the other people, and the middle layer will work as a filter. So you need to have a medical mask. We don't advise N95 mask or respirator for common people because one, it is very short, so there will be difficulty in finding N95 for the medical peoples. Secondly, it's very difficult to wear, so better wear the medical mask. And wash your hands with the soap and the water for 20 to 40 seconds. And if you have got the alcohol-based sanitizer, you can rub your hands with the sanitizer for 20 seconds. Because what will this soap and water and the alcohol do to the virus? They break their envelope, the membrane which is holding the RNA, which is dangerous for us. That RNA becomes useless once there is no coating of the virus. So these are the things which will help you get rid of the virus very friends, easy. Thank you so much for watching the video. And if you think the video is good, please like it. If you think it can help someone else, share it. Obviously, this is a very new channel, so you haven't had subscribed it. So I request you to subscribe the channel, because as the pandemic is going to end very soon, and hopefully so, then I plan to make some videos in English as well. I have got my Urdu channel. The description will have its link. If you want to subscribe that, you can also do that. So thank you so much for watching this video. Stay safe, stay home, stay blessed.